Welcome back to Singapore Property Talk Law. Okay, so you've probably seen the headlines. COVID-19 cases are up again here in Singapore.
Yeah, there's definitely been an increase reported.
So today, we wanted to, dive deep and cut through some of the noise, get you the straight facts on what's going on.
And more importantly, what practical steps you can actually take.
Exactly. Practical steps. How can you protect yourself, protect your family, people you care about? Real quick, if you find this helpful, please do hit that like button and subscribe. It really helps us out and means you won't miss our next deep dive.
Yeah, please do. Okay, so the situation.
Right, the numbers.
Yeah.
What are we actually looking at?
Well, the reports mentioned for the week ending May 3rd, the estimate was around 14,200 cases.
14,200, wow.
And that's up from?
Up from about 11,100 the week before, so it's a noticeable jump.
Definitely noticeable. But we should remember, Singapore treats COVID as endemic now, right?
Yeah.
Since Feb 2023.
Exactly. So the whole landscape is different from, the peak pandemic days. Restrictions were lifted.
Right.
Okay, so more than 3,000 extra cases in a week. It grabs your attention. Why the increase now? What's driving it?
The main reason being cited is waning population immunity. Basically, protection from past infections or vaccinations fades over time.
Right. It's not permanent.
No. And Dr. Leong Ho Nam from Ruffy Clinic pointed this out too. Individual immunity drops if you haven't had a recent shot.
Makes sense.
Plus, there's the factor of lower uptake of the updated vaccines. This means newer strains can sometimes get around the immunity built from older vaccines.
Ah, okay. So the virus changes.
Yeah.
And our protection needs updating too.
Precisely. And that lower uptake also impacts herd immunity. Fewer protected people means less community protection overall.
Right. It weakens the collective shield. We also heard from the health minister on this, didn't we, Ong Ye Kung?
Yes, he mentioned that these kinds of waves, they're somewhat expected with endemic respiratory diseases. It's part of the normal cycle now.
So not necessarily alarming, but something to be aware of. What about the specific variants causing this?
Currently, the main ones circulating are LF.7 and NB.1.8.
Okay.
They're both descendants of the JN.1 variant, which you might remember emerged around August last year. These two account for, well, over 2/3 of the cases right now.
So they're related to JN.1, but maybe slightly different?
Yeah, they share traits, so some existing immunity helps, but they have mutations that might help them spread a bit more easily.
Got it. Okay, so that clarifies the what and why. Let's get down to the crucial part. What can we actually do? Since it's endemic, are we talking about going back to major restrictions?
No, not really. When the shift to endemic happened, the official assessment was that the risk of severe illness or death is very low for most people, comparable to other endemic respiratory illnesses like the flu.
Okay, that's reassuring.
It is, but, and this is key expert stress, that doesn't mean we just forget all precautions. Vigilance is still important.
So what specific actions should people be thinking about, especially maybe for more vulnerable individuals?
Right. Professor Teo Yuk-Ying from NUS highlighted this. For the elderly and those with existing health conditions, they should really consider getting those additional booster jabs.
Extra protection.
Exactly. And he also made a practical suggestion. During times like this, with more cases around, wearing a mask in crowded outdoor places could be a sensible move for them.
And it helped against other things too, like flu.
Yes, precisely. Double benefit there.
What about the rest of us? Generally healthy people.
Well, Professor Teo emphasizes just usual vigilance, good hand hygiene, personal hygiene. These basic things are always effective against lots of infections, not just COVID.
Back to basics, but they work.
They really do. And Dr. Leong added something important for people living with or frequently visiting seniors or vulnerable folks.
Oh, yeah. What's that?
Even if you feel fine, consider taking precautions anyway, because you could potentially spread the virus without having symptoms yourself. Asymptomatic spread is still a thing.
Good point. Easy to forget that. What about if you do get sick? Typical MC duration.
Dr. Leon mentioned it's often around 5 days for self-isolation, but it can vary, depending on how severe the case is.
Okay. And we shouldn't forget, even if most cases aren't severe now, there can sometimes be longer-term issues, right?
Yes, that's something Dr. Leong touched upon. Some studies do suggest potential long-term effects, things like poor cognitive function, respiratory problems, what people call long COVID.
Right.
And maybe even increased risks for things like diabetes or dementia down the line. It just underlines why taking reasonable precautions is still a good idea for everyone, really.
Definitely food for thought. Okay, let's talk specifically about the updated vaccine. How critical is that now with these newer variants.
Very important is the short answer, especially for the elderly and the immunocompromised, because the virus keeps evolving.
So the vaccine needs to keep pace.
Exactly. Dr. Liang strongly recommends it for those groups. Professor Teo agrees, adding that older people and those with pre-existing conditions should aim to be up to date on both COVID and flu shots.
Ah, the flu shot too. Good reminder.
Yeah, it significantly reduces the risk of getting infected and having serious complications from either illness. And the good news is the updated Pfizer and Moderna vaccines, available since last October, they work well against JN.1 and its descendants like LF.7 and NB.1.8.
So the tools are available.
They are.
Now, there's sometimes talk about COVID becoming milder. We are seeing fewer people needing ICU lately.
That's true. The average daily ICU numbers have decreased recently, but Dr. Liang advises caution in interpreting that. Meaning, it might not necessarily be the virus itself getting milder. It's more likely that our widespread vaccinations and prior infections have kind of primed our bodies.
Ah, so our immune systems are better prepared to handle it, preventing the worst outcome.
That seems to be the more likely explanation, yes. Protecting against serious complications.
I see. What about those other theories, like it changing how it transmits? Anything to that?
Professor Teo briefly mentioned some speculative ideas, like maybe it evolving towards fecal oral transmission. But he stressed there's very little evidence right now to suggest Singapore needs to change its whole approach based on that.
Okay, so mostly speculation at this point.
Pretty much. He reassured that surveillance is ongoing, both here and globally. If the virus changed significantly in a way that required a new strategy, adjustments would be made.
Well, for now.
For now, there's no solid evidence suggesting our current approach isn't adequate for the situation.
Right. Okay, so let's try and bring it all together. If someone's listening now thinking, okay, what are the absolute key things I should do? What's the summary?
I'd say, number one, seriously consider getting the updated COVID vaccine, especially if you're older or have health conditions. Number two, keep up with good hand and personal hygiene, simple but effective. And number three, during these surges, think about wearing a mask in crowded outdoor spots. Not just for yourself, but maybe more importantly, to protect vulnerable people around you.
Clear, practical advice. Thanks for breaking that down.
Sure.
So, thinking longer term, as we live with these kinds of viruses, and knowing individual actions matter, maybe the question for you listening is,
Sure.
What long-term habits can you build into your life now, to better protect your own health and everyone else's during future waves of illness, whatever they might be?
Yeah, that's a really important question to reflect on. Sustainable habits for resilience.
Definitely something to consider. Thanks so much for joining us on Singapore Property Talk Law for this deep dive. We really appreciate the insights.
My pleasure.
And we'll be back with more soon.